joining us and tuning in. Why don't we go over some data and then touch on a couple points and then take a couple questions. Unfortunately, we've lost another member of the community to COVID-19. He was a Caucasian male in his 80s. He did have significant medical conditions. We now have lost 37 individuals who've died to this illness, from this illness. 28 Caucasian, 4 of another race, 5 African Americans, 22 females, and 15 males. Related to cases, we currently have 1,088 cases. This is up from 1,047, so we have 41 new cases. We'll get into breakout of those new cases, what they mean momentarily. This next stat, I want to, yesterday, you folks had a day off, I think, yesterday. I didn't have a day off, but you guys did, and our press team here. I want to give caution on this next stat because I'm going to tell you why. Right now there's 51 individuals in the hospital. This is up 10 from yesterday. Part of that is many of our new cases are from senior facilities and nursing homes. Some nursing homes in the community have just been taking anyone COVID positive, whether they're symptomatic or not, light symptoms or asymptomatic, and dropping them off at the hospital. So right now we're working with our hospitals and our nursing homes to get folks that shouldn't be in the hospital out of the hospital, so the hospital is used for people that are necessary of treatment at this point. So that number is a moment in time. That's not a trend at this point. We have 11 individuals that are critical, same as yesterday, representing 2.5% of our active cases. Again, let's, as we think about everyone we've lost and their families, and we mourn them as a community, let's think about these 11 individuals and their families and pray for good outcomes. When we look at who's in the hospital, we have 27 Caucasian, 11 African American, 7 of another race, and 6 individuals that have either declined to share their information or we don't know. Today we have 619 people who have recovered. That's our green curve. That's up 9. That's good. Reminder on recoveries now. We now are dealing with our seniors, and for our seniors to recover, they need to show progress for 14 days. Early on in this process, that was 7 days. So if you're not a senior and you don't have symptoms for 7 days and you have 3 straight days of no temperature, you then become a recovery. If you're a senior, it's going to take you 14 days before we talk about you being a recovery. So our active caseload under this new criteria, considering most of our active cases now are from affiliated senior facilities, will stay longer than what they were in the beginning of this process. So when we look at our numbers, our positives, 1,088, that's our red curve. We presently have 432 active cases, our yellow curve. 147 of our positive cases are now household contacts. This is 11 more than yesterday. So out of our 41, 11 are household contacts. Why do we separate that? We separate that because these are individuals who are already in a quarantine. They had contact with another household member who was COVID positive. They've now become positive. We knew that this was going to happen in this process. This does not strain our infrastructure related to our health departments. And also our individuals that attained COVID-19, the COVID-19 virus, while in a quarantine. So the risk of community spread with these individuals is not great whatsoever. 12 of our new cases are related to senior living facilities, nursing homes, assisted living facilities. So out of our 41 cases, 23 are from contacts or affiliations, 18 are from community spread. So a little bit less than yesterday and the day before, but a little bit more than where we were last week. So of our total cases right now, almost 70% are related to contacts or affiliations out of our active cases. 432, when you look at the amount of active cases for senior-related affiliations and contacts, it's about 300 of those cases. So certainly, when you look at the community spread intensity, it's not as intense as it was in the beginning of this process. It looks like we're seeing our new 7-day average. We're 3 days into it. Certainly more cases in the community than our last 7-day average, but certainly manageable. But it's important for everyone to understand we still need to physical distance, and we still need to look out for our own health and the health of others related to this. And we're going to have more data on more trends we're seeing with community spread, and we're going to talk more about that over the next few days, especially going into Mother's Day weekend coming up soon. When we look at quarantine numbers, we now have 1,200 people in quarantine. Again, normally you see your quarantine numbers go up when you have community spread cases go up. We then find the case, you test positive, we then trace your contacts, and then quarantine. So that number has gotten larger due to the really last 3 days worth of community spread cases, which were larger than the previous ones. When we look at who our positive cases have been, 622 female, 466 male, 35 are under 19, 186 are in their 20s, 139 in their 30s, 145 in their 40s, 178 in their 50s, 161 in their 60s, 109 in their 70s, 89 in their 80s, and 46 in their 90s. 20% of our cases have been under 30 years of age. 33% of our cases have been under 40. 46% of our cases are under 50. 63% of our cases are under 60. And 37% of our cases are over 60. When we look at cases by municipality, 543 total cases, City of Syracuse, 263 recoveries. Town of Clay, 95 total cases, 71 recoveries. Town of Onondaga, 80 total cases, 28 recoveries. Town of Manlius, 59 total cases, 39 recoveries. Town of DeWitt, 55 cases, 33 recoveries. Town of Salina, 44 total cases, 33 recoveries. Town of Cicero, 42 total cases, 29 recoveries. Town of Camillus, 39 total cases, 30 recoveries. Town of Geddes, 36 total cases, 21 recoveries. Town of Lysander, 29 total cases, 18 recoveries. Town of Pompey, 22 total cases, 20 recoveries. Town of Skaneateles, 15 total cases, 13 recoveries. Town of Van Buren, 7 total cases, 3 recoveries. Lafayette, 4 cases, 2 recoveries. Marcellus, 5 cases, 4 recoveries. Atisco, 5 cases, 4 recoveries. Elbridge, 2 cases, 2 recoveries. Fabius, 2 cases, 2 recoveries. Spafford, 2 cases, 2 recoveries. And Tully, 2 cases and 2 recoveries. Geographically, the virus has been in every part of our county. If you have a piece of real estate related to senior housing, certainly in your community, that is the robust number of active cases left in your community. Related to testing, we have done, and we'll talk more about this, we've done a lot of testing. We've had over 13,586 tests administered. What is not in that number are negative tests from the state of New York. The state of New York does testing in nursing homes. They have been testing in nursing homes. We get the positives, we don't get the negatives. So out of that, we have 13,254 tests that have been returned. 1,407 tests have been returned since Friday. Think about that, 1,400 tests since Friday. That's a massive number over 3 days. This obviously is explaining why we've seen larger numbers of positives. We got 1,400 tests back in 3 days. You see 47, 53, and 41. The percentage of testing has essentially been the same. throughout this whole period of time. We're just finding folks that are asymptomatic or light symptoms that would never have gotten tests previously. They wouldn't have fallen under the CDC guidelines. This effort is really because of our proactive testing program that we've implemented with our assisted living facilities, some independent living facilities that have had positive tests we've already gotten to. We're going to get to a lot more of those moving forward. And this is what the state is talking about mandating moving forward in a restart. So we're prepared for that. There have been 1,088 positive tests, 12,166 negative tests. We have 332 pending tests. There will be more testing today. Out of the 332, certainly many of those tests are proactive. So even though we've had slightly more community spread cases, the demand for community spread on our facilities has continued to go in a downward trend. Right now, yesterday we sent out 361 tests. I think about 275 of those are related to proactive testing. So about 8.2% of our results have been positive. Again, it's probably a little bit less if we could have the negatives in from the state of New York into that number. But that's been consistent. We've been between 7.5, 8.2 this whole period of time. So that hasn't really changed. We're just doing more testing. We're finding more people that are asymptomatic or with very light symptoms of COVID. Physical distancing, important. One of the things why we are looking at, we think we have more positive cases over this weekend was because of the nice weather from a week ago. 3 to 5 days of incubation period for the virus, 48 hours to get testing done, turn it around. Sunny days we think will lead to more tests. That's why it's critical that we really look out for ourselves and each other with physical distancing. If you look at where we're seeing a lot of cases involve retail stores, whether it's employees or whether it's people. Obviously, we need to buy things, and we need to do this. Certainly, wearing a mask is something that I know some people have a problem with. I appreciate that, but at the same time, it also will help from having saliva and mucus transmitted into the air. So certainly, please, social distancing, masks, these are important things as we live with the virus because people are going to be coming back to work. There's going to be more people around. We need to be smart. Restart, we'll take some specific questions on that. The governor showed in his presentation some slides today, specifically to testing capacity. If you look at how he was looking at it today, a 7-day average moving backwards of testing capacity. Our community wasn't there yet because that didn't entail all of our proactive tests. But our understanding is they're going to be looking at moving forward from May 15th, not backwards. Because if you look at it backwards, no community will be meeting that because every community was doing CDC guideline-based testing. And based off of the CDC guidelines, meaning you have to be sick to get a test, we couldn't meet the governor's number through 2 months, let alone for 1 month, because there just weren't enough sick people. So most upstate communities will be in that same boat. So we're going to talk to the governor's team about that. We had a little bit of a conversation. Moving forward from May 15th on, doing 13,000 tests a month is not a problem. Even if you look at our last 3 days of 500 tests a day that we've gotten back and have been doing, that's more than what the governor is mandating for a restart. So that's not a problem. Our community is already there, but you can't go backwards looking at it that way for a restart. You got to go forward. So we're working with the state on that. But I know that would be a question. We believe we met that benchmark, and we'll work that out with the state. Related to tracers, we have the number of tracers we need. We already have tracers that do this every day in our health department, about 60 of them. We've cross-trained another, are in the process of cross-training another 80 to 100 people on tracing. So when the event happens where you need more tracing done in a situation where there's more cases, we have those folks who are doing this type of work already in county government, just not in our health department. Think about adult and long-term care. Think about children protective services. Think about our law enforcement agencies, our probation teams, all doing tracing in their own respects, now cross-trained. We have met that threshold. So when we look at the governor's threshold, we're ready. We're ready for a restart. We'll work with the state to understand what phase one looks like for our region. Certainly our partners in the Mohawk Valley and Central New York. We've been preparing. We've been working very well together. And certainly we're ready for that phase one as we bring more people into the workplace, which presents new challenges for us and our health department. Libraries, we've gotten a lot of questions about libraries. We'll make a decision on the date for libraries, but libraries will be a phased-in opening. We'll probably start libraries with a curbside type service. Then we'll probably move into another phase where specific hours will be made available for specific individuals, whether it's seniors, people who have underlying medical conditions come at a certain time, children and families another time, and then we'll phase into them being open to the general public. But that timeline has not been set, but we certainly are going to have a phased-in opening of libraries. And access to assistance, our Upstate Triage Hotline. Again, I think this is an important number. I'm hoping, knocking on wood, it's not, but it was very sunny over the weekend. I have a feeling people are going to get sick from that. 315-464-3979. If you have symptoms, you're sick, you don't have health insurance, call our Upstate Triage Hotline, 315-464-3979. They will screen you for testing down at our Syracuse Community Health Center. Our seniors are healthcare workers and adult nutrition line, 315-218-1987. Right now, this line has been handling folks who have needs that never had needs before, whether it's a meal, whether it's help with groceries, toiletries. We've been even dealing with mask requests. Please call that line. It's a new type of service that we never thought we would really be doing, but we've been doing it and doing it quite well. Childcare Solutions, our continuity of care plan for daycare for essential workers, extending it through the month of May. 315-446-1220. If you have a child care lapse, you need help, you got to go to work, you're going back to work, child care is an issue, contact Childcare Solutions to enter into our daycare program. And social and emotional support, 211. Mental health is becoming an ongoing issue. It's tough. Our behaviors had to change quickly, change radically. We're now going to have to modify our behavior moving forward. If you're having a hard time, that is nothing to be ashamed about. Please contact 211. 211 has received over 13,000 calls in this process since March 17th. So many of your neighbors are in the same position that you're in. Please contact them and get help. Questions? No, I think you saw the governor's chart today. It was pretty clear on what they're looking at. You can't demand proactive testing and not expect new cases. So, so it's either one of the two, right? So and why he's right for proactive testing is because you need to find who the asymptomatic carriers are or the light symptomatic carriers, so that you can quickly quarantine them and eliminate that spread to the community and get them help. If the idea was that you need to see less cases every day for 14 days, that's the only way you're going to open up your economy, then nobody's going to do proactive testing. Because why do you have to open up your economy? Because my health department costs money. I can't have the economy shut down for 6, 7, 8 months, especially when the federal government and state government aren't giving us money. So you have to find a way to live with the virus. In Central New York, if you look at us and you look at our region across New York State, and you take the North Country out, the North Country doesn't have the population we have. How do you go from best to best? We're already the best. We're not close to being kicked out of that regard. So we're already in the best. So you can't, what you need to do, and the reason why stop the spread, flatten the curve, that was all about preserving your medical infrastructure. And what it does is when you flatten it, but you prolong the virus essentially. Your process with the virus is flattened and it's managed and it goes longer. Whereas if you saw those other curves, they go like this. The problem is you lose control of your medical infrastructure in those other curves, and more people die. But once the virus is gone, it's usually gone. So we flattened our curves. Moving forward on restart, we want to continue to proactively find the virus every step of the way. So the governor has very ambitious goals he's put on us for testing, but you have to do 13,000 tests and have cases going down because you'll never open. You just won't. It's impossible. And that's why what we've done, and how do you know that? The only reason our cases have gone up in Onondaga County is because we've been proactive testing. It's the only reason. If we weren't finding these, if we weren't saying to New York State, we need you to work with us on nursing homes 3-4 weeks ago, and we're going to go do assisted living, we're going to go do independent living, our caseload would be 250, 300 people less than what it is today. But they'd still be there, spreading it, getting sick, and eventually we'd lose more life than we needed to. So the point of this is, to your original question, I'm glad you asked it the way you did so I could talk about it, but that the state's loosened up that concept about caseloads going down, because when we weren't proactively testing, that's what happened. We already kind of met that 14-day threshold, just like we did with hospitalization rates. That's why we got elective surgeries back. But moving forward, the community should be prepared that we will have new cases every day, as long as we're testing the way we'll be testing until the virus leaves or there's treatment for the virus. So as a community, we should be prepared that there's going to be more positive cases, there's going to be risk. We need to mitigate that risk every step of the way with good policy, and really the community themselves taking leadership roles in this process moving forward the same way they did for a period of time during this process as well.
Ryan, I want to work through the two metrics we don't meet on the governor's slides, and we do meet more than any other region according to his slide. So the first one is 30 per 1,000 residents tested monthly. You alluded to that a minute ago. Could you tell us where we meet that now and why we don't? Why? Because it's retro, because we...
Yeah, so
you know what I mean?
In that
it's
same
confusing.
slide, the governor used a 7-day average, okay? So his 7 days is he's looking backwards at what's happened. This is a change in testing protocol. So the rules of the game are being changed. No community has been doing proactive testing, with the exception of a couple others besides Onondaga County. We started this before. We don't have enough sick people to meet that threshold over 2 months, let alone 1 month. Okay, over this last 2 months, when we were in the heat of the intensity of this virus in the beginning, we did not have enough sick people to meet that testing number. So the only way you meet that going forward is proactive testing. So you can't go backwards in how you grade that. Now, we've started ours over the last 3 days, and now 4 days, we've met that, if you look at it. So our 7-day moving average for our county, we can probably meet. But for our region, this is a region, not just our county, have we met it? I don't think. I don't know. Can you meet it moving forward? Absolutely. We already have buildings planned for testing every day going forward, and we'll absolutely meet it. We're going to look at community spread numbers. We're going to go into anything we can possibly see that tells a story, whether it's going out and testing neighborhoods, because we've seen spread in certain neighborhoods, and we're going to go do it all to meet this.
How many tests would we need to be doing per day, or I guess it's on a 7-day average, to meet? What's the number?
It's essentially 13,000 a month
for the county.
For our county.
And these are regional.
Correct.
Metrics.
So each county is going to have to do that. Not a problem. We'll do it. We got the test kits to do it. But you need to. That's serious scaling up. That is. I mean, the intensity of the virus is not the same today that it was when this started. So you probably are looking at maybe in 30 days, 4,000 CDC type recommended testing going on at the primary care providers and all your testing sites. That means we have to go find 9,000 people to test to meet this mandate. So that's just, I think, one way to look at it today. We think the state's we're going to talk about how to look at it moving forward. We're going to give them our plan. We've put up together a plan because they know this numbers. They know they did the antibody testing. They know the percentages of people that have been infected and that we can't. It's not 13,000 people that's been impacted according to their own testing.
So we can meet the requirement, or you don't think we can, but it's not a fair
No, we can
requirement?
meet it. We've already, the ability to go test 13,000 tests, give me 13,000 people, but we got to do it the right way. I can go do it tomorrow. We won't get the results back for 30 days because of the labs will get backlogged. But we have 13,000 tests to meet this. How the trigger, the question we're really talking about is what triggers it. What should trigger it is the plan moving forward because you're changing the rules of the game. It will not work for every other community in Upstate, probably besides ourselves and maybe one or two others, if they have to go backwards and look at the past 7 days. There's no way they were doing that testing. There's no way. It's moving forward. That's the goal for restart. And do you have the testing capacity to do it? We do. So we believe we've checked that box.
The other metric is at least 30 contract tracers per 100,000 residents. If I'm doing the population math correctly, that's 138 tracers for Onondaga County.
Check.
And
We
what
have that
about
many?
the rest of the region? I think it's 233 for all of Central.
I thought I saw on that graph that there's 238 or so in Central.
233.
Now, I didn't see anybody get the check in the tracing part yet from the governor's graph.
His is 233, and you're right. Nobody
Got it, right?
Nobody's
So
got a green.
what I believe is going on, and I don't know because I haven't talked to the governor, is that they got their own initiative that's probably going to be working with our health departments on this. So I don't think anybody got the check there. We told them what we have, and we can scale up on this. Remember, we protect the communities vulnerable in all of our departments. We do tracing, contact tracing in every department. This is now contact tracing for COVID-19. So the cross training's already started. We already have them here. We're taking them who do the same thing in other departments, cross training them on this. Boom. You can check that box. We got it.
How much does each test cost? And 13,000 tests a month moving forward indefinitely, that's got to be a lot of money. How are you going to pay for that?
Most of the, so I don't know how much the specific test costs us for the test kits. You have labs, private labs that have capacity each day. Right now, I believe the federal government is reimbursing them for doing that. The person being tested is not being charged that. So you look at your community health center has so many tests a day they can do without us giving them more tests. Hospitals have so many they can do. Walmart has so many they can do. Pharmacies are going to now be in this game. At what level of capacity, I don't know yet. But then we have reserves, and we are going to be stockpiling PPE for today and for tomorrow and for the fall. So we will have, right now we could do the month of May 15 to June 15 mandate. We have enough tests to do that ourselves, let alone all these other labs. And we'll continue to go out and procure when we have lapses. But certainly we understand why the governor wants to do it. We've been doing proactive testing for the last 2.5 weeks. So we agree with the governor on it. We just say you can't, for the rest of Upstate, we can probably squeeze by this rule. You can't go backwards when the rules have been to this day CDC guidelines and then expect them to hit these numbers. These are very tough numbers to hit. We'll hit them if that's the way what the rules are going to be, but we think moving forward is where they're going to be.
Is the state promising to be the source of test kits going forward to meet this mandate?
I think the state's been doing a nice job procuring test kits now, Tim. So I believe that's going to be part of that. I think if you're going to tell a community, again, 13,000 for us, it's going to be smaller numbers for others, but they haven't been getting a lot of test kits to begin with. So certainly, anytime there's a mandate put on anybody, if you're going to put a mandate on somebody, you got to help them achieve that mandate. And certainly with PPE supplies, the more the state can give us, the better. But the state's been a good partner of ours related to PPE. They've been there when we needed them. And so I anticipate they'll be there moving forward as well.
Is the state's definition of Central New York the same 7 counties to your right?
So the state Central New York is Cortland, Cayuga, Madison, Oswego, and Onondaga. And Oneida then goes into Mohawk Valley, and they go into all their partners with Herkimer and Fulton County and Montgomery County. And so they're our partners in Restart because we're connected. We make up the greater Central New York region. But those are the two. When you look at Central, then you look at Mohawk Valley. Those are the two separate regions, but we've been working together related to Restart planning.
Is there a county that will hold back Onondaga County if we're being graded regionally?
I don't think so. I think we're really the anchor. Our data is going to, if we're meeting our numbers, that will help get the other counties over the top. Remember, Cortland County, very small county, they, many days in this process, they don't have any cases. Cayuga County, the same. Many days, no cases. Oswego County, many days, no cases. Madison's had a little bit more of a challenge, like we have, with, a lot of various, with more density. So I think our region's the best. If you look at, population-wise, compare us to North Country, and then look at our numbers compared to theirs. We've weathered this storm well. Some of it's luck, a lot of it's planning and preparation, healthcare infrastructure. Our residents took it very seriously with physical distancing. When you combine all those factors, we are where we are today, and we're ready to start to test the virus in this next phase as the economy restarts.
Are you disputing the governor not giving Central New York the 2 green checks, as you like to call them, for those 2 metrics?
I haven't talked to the governor directly, nor has he talked to me about this, Andrew, but we can meet those 2 thresholds today. So if he's saying you need to show me you got to meet, I'm going backwards a week. Within 3 days, I'll be able to meet the threshold because we're doing that much proactive testing.
What conversation have you had with the senior living facilities or nursing homes that are sending patients to the hospital regardless of the severity of their symptoms? Because hospitalization's also one of those.
So we're communicating with those. A couple partners in that space now are stepping up. Some of these facilities, literally, they get a positive, bringing the patient to the hospital, whether the positive is sick, asymptomatic, light symptoms or not. So we're working with the facilities to take those patients. So if you're sick enough to be in the hospital, that's where you should go. But many of these individuals were not sick enough to be in the hospital. But certainly when you have spread in some of these facilities that we have had, they're going to get sick enough in this process where they need to go to the hospital at times. But we've already met the metrics from your 14-day CDC. So that's why we had the check. There's triggers related to moving forward. If you start to move forward too much related to capacity, there's triggers that would slow things down again. But those triggers aren't going back up to your peak. That means that you've got to stop. The triggers are actually much larger when you look at it.
Was that influx in the hospitals from nursing homes specifically? Is that what you said? And do you attribute that to more aggressive testing in the nursing homes by the state recently?
Correct. So you have testing going on. You have positives. Some of these nursing homes don't have, if they don't have the COVID floors and what they're doing, and I guess it's perfectly acceptable. I guess it wouldn't be acceptable to me if it was my family member, but I guess once these folks have a COVID positive patient, they have the right to bring them to the, well, not bring them to the hospital, but they have the right not to have them in their building. So what they're doing is they're bringing them to the hospital, creating a logistics issue. And now we're working to make sure that people that should be in the hospital stay, and people that shouldn't, we find another facility for them to be at.
Hospitalizations, though, couldn't be attributed to proactive testing because it's a sick person. It's somebody that would be tested based on the old CDC.
You can when you have facilities who get a positive and then essentially are kicking them out of their facility. Sure, you could. That's what's happened. That's why that number is higher.
So you're working with hospitals to get them to other facilities rather than send them back to the nursing home where they came from?
Correct.
What other facilities are available
Other nursing homes.
that have the ability to isolate wings?
Correct.
Would you answer my question again just so I understand what you said?
The reason why they're higher today, Andrew, is because you have individuals who've tested positive in a nursing home. They are not sick enough to go to the hospital. The nursing home is just taking them anyways. So that's why I give caution today, because I know of many cases that I've been talking about this, and I've had to learn about this very quickly with our team. And so essentially tomorrow, unless we have many people who are legitimately sick that are new hospitalizations, this number will be down, because there's people here that we have asymptomatic people in the hospital just because they lived at a nursing home. That means they have no symptoms.
And do you mean the 12 nursing homes that are managed, for lack of a better term, by the state? We're talking specifically nursing homes?
Well, none of them are managed by the state. They're regulated by the state.
That's
but you're talking about, yes, you're talking about some specific facilities that have taken their COVID-19 patients and moved them to the hospital just because they're COVID-19 positive, not because they need to be hospitalized. Yeah, the reality of this is I don't know if there's an intention to socially distance less. There's just more people. And when you have a nice day, you get everybody. I took 2 wonderful walks on the Loop the Lake Trail, our famous Loop the Lake Trail. And I had a mask with me, and when nobody was around me, I would take my mask down and enjoy the fresh air. But when somebody would ride a bike by me or run, I would put my mask on out of courtesy and respect for everybody else there. Nobody knows where I've been or who I've been hanging out with or how I'm feeling that day. So I think these are kind of the common sense things we have to do moving forward. And it's important when we are enjoying the weather, which we have to. We got to get out and enjoy the weather. This has been really, really hard. But we have to think about the community at large still. And certainly physical distancing, wearing a mask when you're in a grocery store, or you go to Walmart, or you go to Target. Target, I know they're not letting you in. Walmart still will let you in without a mask. And some of the Walmarts have had quite a few cases that we've had to tell the public about the past week. But these are things that it's just common sense. Even if you hate the rule, it's just common sense. And so we just ask everybody to abide by that. And it's going to get harder as we get more people together. But that's how we're going to learn more about the virus in the next phase.
Ryan, you talked about opening libraries in phases, and I think talking about that a little bit more might help people envision phase 1. So curbside pickup at libraries could be part of phase 1 potentially, and would that amount to like ordering books online and driving up?
Exactly, kind of working to do things online, pick up curbside, think about takeout restaurant. Phase 1 of libraries will look like that. We'll give out more details. Phase 2 of libraries will certainly look at still doing the curbside, then expanding access to libraries for specific sets of the public. Children and family can come in at these hours. seniors these hours, underlying medical conditions these hours. And then phase 3 is a little bit more of a broader opening as we learn more and more about the virus. When we think about our buildings, the hardest ones to that manage would really be libraries. In our building, if you come into the Civic Center right now, one point of entrance, security, masks, you need them to get in. So there's ways to control that, but libraries a little bit harder. So we're going to have to phase that in. There's traditionally a lot more interaction with the public overall. So we'll phase that in similar to how we're phasing in the economy.
Are there other kinds of businesses that are closed now that where you could conceive of curbside services?
Yeah, and we get more and more suggestions every day in our inbox about things and looking at it differently. And it's really a massive undertaking to look at all of this and try to figure out how to regulate all this. But certainly there's been some non-essential retail that you probably could have had opened up curbside throughout this process. I'm not quite sure how much more you can do. I think phase 2 will be the big phase where you really test everything. Phase 1 looks like you're going to have your industries that are allowed to be open for certain things will allowed to be open for everything. And that's kind of consistent with what we've been talking about with the state. The governor gave us more ideas today, what he's been thinking about. We continue to have those conversations, but phase 2 is certainly I think the big test. And so you need to go through phase 1, start up, and be in a good position with your health departments, because phase 2 is when you're really going to test the virus. And maybe we have really sunny weather there. Maybe there's some suggestions that the states that are sunnier are doing better now because of that from some of the doctors. Dr. Gottlieb, I heard talking about that today, who former FDA commissioner. So maybe by that time, when we're opening things up, we'll get a little bit of reprieve with weather, and we won't see the spikes that we think we could see. But certainly, when phase 1 happens, we are preparing for more cases, and that there will be more cases. And we'll need the community to help mitigate that. We'll need the community to really be cognizant of your health, not leaving your house when you're feeling sick, when you're out in the public, protecting yourselves by wearing a mask, physically distancing. And we'll need employers, even when they open up, just because you're opened up doesn't mean if people can do their jobs from home, you shouldn't let them do their jobs from home either. That's part of this too. Certainly we're going to reevaluate that in county government. How many people do we actually need in the building every day? Can people get things done from home? They have been. Why can't that be protocol moving forward as well? So Live Nation is really in charge of that. Certainly we're concerned that we're at minimum losing acts for the year. I think it's too early to say if we're going to lose a whole season. Certainly, if Live Nation canceled their season and we have an amphitheater and this virus behaves like SARS did and is gone for the summer, we can certainly look at other types of acts, local acts or things to give opportunities to. But right now, we're always hopeful that we're going to hope for the best until the reality is that the best is not going to happen anymore. So I'm still hopeful we'll have concerts out there this summer. But certainly I think concerts in June and May for sure are not going to happen. So, is there a shot for some of these acts in July and August to September to go off? Maybe. Live Nation is going to work through that. They're who we have in charge of that.
I know you've seen Dan Palladino's plan for reopening Heritage Hill in Pompey as part of Phase 1. He'd like to be part of Phase 1. Are there businesses that can make the pitch to you, and as long as they have an appropriate plan, you include them to the state as part of your Phase 1? Yeah,
so we're really with the conversations with the state, it's more industry specific and not specific businesses. And so I'm not going to comment specifically on Dan's plan. He's got a good plan, but whether that goes into what phase, that's a decision that we'll have input on, but certainly the state's going to be giving guidance on that.
His whole pitch, though, is to not make it industry specific, make it business specific, because
It's too hard.
you know, an indoor restaurant versus a restaurant with outside dining should be two sets of grading.
Yeah, it's too hard. We can't. You can't go through. I mean, how many businesses do we have in our county? There's not an infrastructure to go through a regulatory process over a period of 2 weeks to have them go phase one and then get all those approvals, thousands and thousands, and then by the time you get your approval, you're probably into phase three when you could have gone in phase two. So that's the reality of this. This is all uncharted, unprecedented. You really got to go industry by industry. He might be a little different because I think he's got a big ag component to his business, but you can't say to some restaurants, you know, you can go and others you can't go. Restaurants need to be given proper guidance. This is what you need to do. This is how you got to protect your employees, protect your clients, and you can go on this date.
Outside versus inside doesn't make a big difference?
I think it does. I think the doctors will say there's some of these facilities there's less risk being outside with everything you do, but overall, when you're looking at, everybody will say I'm outside. I can put a table in my front of my building. I'm outside, right? So it's just too hard. It's too hard. I respect what everybody's going through, and I'm sympathetic. I'm sorry for all the small businesses that have had to shut down. I'm genuinely sorry about that. But the phased-in approach has to be by industry. The state's not going to approve anything other than that, and nor do we think it would make a lot of sense. Oh, yeah. So we've gone up. Okay. Well, so if you call 911, we've dedicated a response for the appropriate law enforcement agency to get the call. And then that law enforcement agency is going to use their discretion. I will hopefully have specific data points that I can talk about this week that we believe will be eye-opening to people when they're thinking about Mother's Day. So it's a balance, and I am concerned about any time we have nice weather, what it's going to do for new cases. And for the most part, these new cases, when you look at community spread, these are cases that are a better indicator of the intensity in the community. But usually these are the cases where people eventually get better. And so they're not, when we look at our hospitalization numbers right now, and we look at who's getting sick and who's dying, we know who these people are. It's not; these aren't usually random infections. But think about it this way: if you're dying to go back to work, you get the call to go back to work, but you want to hang out at a party. Somebody had a temperature. You aren't checking temperatures to go to the party, right? And then all of a sudden, you get COVID. You're out of work for another 2 weeks at least, and your family all ends up getting it. So it's very disruptive, and it's no joke when you have it. So we're concerned. We're going to share some more data that we have found that we think will be interesting, which will hopefully make people think a little bit about how they're going to continue to physically distance moving forward.
Is your group of county leaders still working on a document to submit for the restart? And will that mostly be an argument for when we should restart, or will it describe argue for certain parameters for what can reopen first?
Yeah, I think it's more the latter. The when is May 15th, May 16th. That's the when for both Central and Mohawk. And we certainly believe that there probably could have been things that we could have did a little bit earlier than that, but we understand the New York pause order wasn't going anywhere. So what it details out, Tim, is more of our concepts on what can go in certain phases and what can't go in certain phases. A lot of input from the business community on guidelines for businesses, tools for businesses, communication strategies for businesses and the public that we want to work on collaboratively as a group. And so that's kind of where we are still talking. We're working all together on communication strategy when we know what each phase is going to look like and how we're going to do this to communicate well with the public. But certainly the when, we now believe we've met what triggers a when.
So if your plan's accepted, I mean, it could become the prototype for the state.
We looked at it that way, yeah.
The categories are going to be consistent throughout New York, right? So what can be part of which phase?
Yep, and we in this process, we've put that much diligence into our thought process, not just how does this work for us, but how would this work for every other part of the state or not work. And if it didn't work, we went back to the drawing board to try to look at that. And I think we then talk about these ideas with the state. The state's got to confirm that they agree with these ideas, and hopefully we're going to get there closer where we'll know moving in. The governor touched on a little bit more phase one today than he had, but certainly probably a couple other things we'd like to see in phase one, with our other county leaders.
How were you made aware of the asymptomatic patients being dropped off at the hospital?
Because we got more of them yesterday, so I said, what is this number all about? And then we reached out to the hospitals, and they started actively telling us what was going on. Check in today, they got even more people being dropped off. And so we talk every day with all of our partners, constantly. So technology is amazing.
Is that true at all three hospitals?
I don't know if one or two of them got them all and one didn't. I'm not sure about it, but.
And have you spoken to the state which regulates the nursing homes?
My understanding is nursing homes can actually do that. So they weren't doing anything against their guidelines. They can actually do this. So we don't like it. So that's why we're working with other partners to help alleviate the situation.
How open is the state to some of those ideas that you have about reopening? Because today Cuomo said phase one is construction, manufacturing, and select retail curbside pickup, and most of that is going at some rate right now. Mm-hmm. So are they open to your ideas of adding more to phase one? Those three were in our ideas. We'll see if we can get some more of them in there. I think this is a process, right? So you never want to get out in front of each other on it, or at least we don't want to get out in front of the state on it. But certainly we think there's some more things that are deemed essential today that have regulations, that those regulations can be removed, and maybe we can put some things into phase one that you can regulate in a way where it's safe. And then you do that, and then by phase two, you can then maybe loosen those regulations if things are going well. So it's a process. It's a ton of work. It's a ton of work for us. So I appreciate what it is for the state as well.
At this point, what phase would barbers and hair salons fall into?
Tim, I wish today was the day for that, but I'm getting in a lot of trouble when I speculate on this question. So I have an angry group of hair salon owners emailing me a lot. So I will say that we are sharing some of these business plans from hair salons about specific ones that have one chair or two chairs in their salon, and they're 8 feet apart literally, and appointment only type things. We're sharing these concepts with the state. The state's going to make that call. That call is going to have broad statewide impacts. So whether it's phase one or phase two, I pray that it's not phase three.
How different does May 16th look than May 15th?
May 16th or May 15th? Yeah,
okay
yeah.
with a
As far as
Saturday, so
business,
go to the
okay.
next
So
Monday.
meaning we're bringing back people to work on May 16th, hopefully, and May 15th they weren't there. I think it will be a level of an emotional victory for the community that we're learning to live with the virus. We know more about it today than we did on March 16th. We know how powerful it is. At the same time, we have a lot of folks that are working very hard to manage it. We've been able to manage it. And the next step of this process in this fight is to really learn how to live with it and live with it in a different way. And that means bringing more people back to work, getting the economy going again, always finding that balance between your economic interests and your public health interests. That's going to be the challenge moving forward, and we'll find it. So I do not have a police department. So enforcement is you're going out ticketing people. I don't have a police department. What we have is we have 911. We have the ability to put in orders, which we have, and then your law enforcement agencies have received guidance from the district attorney and the elected sheriff. They have decisions to make, and what we have been pretty consistent about large gatherings, how this is a bad idea, and that it provides opportunities for spread. Now, again, at times, every law enforcement partner is going to have to make an on-site call on whether or not it's safe to enforce something based on what it is and what the circumstances are. But I think you've heard from the mayor a couple times up here talking about how they have a social distancing unit now that's going out and working on this. I'm sure they'll be busy going into the weekend. I'm sure they were very busy this weekend. But the county executive does not have his own police agency, or else we certainly wouldn't be enforcing it. But that's not suggesting that everybody else won't be enforcing it.
So it sounds like what's in phase one is still a matter of some negotiation and discussion. How long do you imagine phase one lasting before we go?
Hopefully 2 weeks, and then that's enough time that the health department has to do its analysis to really look for any new trends. Did we see any new outbreak of community spread cases in certain parts of the community? What's the data telling us? If the data is just telling us we have more people, therefore more density, so therefore you just have a certain number of more cases, that as long as your medical infrastructure is intact, your ability to trace in real time and test in real time still intact, then you go to phase two. But after phase one, if the story is something different than that, your medical infrastructure is struggling, or your ability to track and test in real time is struggling, then you probably phase one to phase two may take a little bit longer.
Are you expecting to have certain metrics like we have for the May 15th opening, to where after 2 weeks you're going to have to meet the benchmark?
Yeah, I think we're going to work through state health on that, and our health department will have their own ideas. Dr. Gupta and her team are working on that, what they expect to happen, and what if X or Y happen, they're uncomfortable. So they're not quite there yet, but certainly you got to have some sort of data-driven metrics that once you get close to those, you really need to understand what's going on before you can move forward with phase two.
It'll be the state's decision as to when we go to phase two?
I think the state has said 14 days. I think that's consistent with everybody. I think each region will have metrics that the state will probably have to approve, and so we'll do that. Okay.
One more question.
Yep.
The nursing home patients in the hospitals, if you can't move them out, is that going to disrupt your readiness for phase one if that continues?
No, because the CDC, remember, we never got to the point where our medical infrastructure was in peril. So the CDC guides, and it's not fair, again, when you're at, I was saying this yesterday, what are we at, 0.23 of positive confirmed cases? So to hold us to a standard of our percentages are great, they're not good, they're great, and to say you need to be better than great is tough. So when we looked at our hospitalization rate, we had to take the peak and show a 14-day downward trend, which we did, but our peak was never bad. So our peak was good, if not very good. So we never got stressed. So to say when you have, I don't know, 1,000 plus hospital beds, more than that, and you have the ability to surge to even more than that, and you got 50 people in the hospital, like it's time to panic, that's just not being rational. So, but that's where our peak number was only 53. So we had to go down for 14 straight days to trigger. We did. Now we've gone up because we have people being essentially dropped off at our hospital that aren't sick enough to be in the hospital. They need to be isolated in an area where they can get the medical help they need. That's not the hospital. Anything else? I just want to give a big thank you to the Southern Onondaga County Milk and Egg Giveaway at Fabius Pompey Elementary School, 7800 Main Street in Fabius, on Thursday, May 7th, 4:30 to 6. 1,000 dozen eggs. 1,000 dozen eggs. Wow. And 750 gallons of milk will be given away. This has been sponsored by many donors within the community who have gave money towards the eggs from the Smith Egg Farm. And I want to thank Chairman Dave Knapp and Fabius Town Supervisor Melanie Velarde and Alma Hartnett for your wonderful effort to help